Good morning or good afternoon, everyone. My name is Amelia Shaw, and I'm the Executive Manager of IAP2 Canada and IAP2 USA. It's with extreme pleasure today that we get to welcome our IAP2 Core Value Award winners. We're focusing today on the winners for Organization of the Year, both for the United States and Canada, and also Research Project of the Year, which was won by the Jefferson Center, along with many others. So we're super excited today to learn about what they have done in order to become Organization of the Year or Research Project of the Year. So we really welcome your questions and your comments and everything else as we welcome our presenters, Chris and Jason, Tina, Andrew, and Shannon. But before we go into too much more detail, Drew, I'm going to hand it over to you for your housekeeping tips. So over to you, please.
Well, as Amelia pointed out, this is a very interactive session, so we're going to invite your questions, your comments, and so forth. There's a couple of ways you can ask your questions. One of them is to click that little hand icon that you'll see on the control panel on your screen, and it's got a little blue arrow and a yellow hand on it. Click that. Amelia will see that you've raised your hand, and she'll open your microphone and ask you to ask your question, make your comment. Or if you don't feel like having your comment go blasting out over the airwaves, you can type your question into the question chat box, and Amelia will break in when appropriate and ask the question for you, or make the comment for you, however, whatever it requires. As I say, it's interactive here. We're also recording this, so you can refer back to it for your professional development. It's also a value add for other members of IAP2 Canada and IAP2 USA. And we'll be sending out a survey afterwards, too, where you can give a few comments on the general presentation, the webinars, and also make some suggestions for future webinars. We're always open to the suggestions on that. So watch for that in your email box after this is over. Usually we'll get the link for the recording of the webinar, get that posted within 24 hours, and then we'll share that around. So with that, I will turn things back over to Amelia.
Thank you so much, Drew. And yes, it is meant to be interactive, so please ask lots of questions, make comments, all of those kinds of great things, because we have some excellent presenters today. Drew and I are always very fortunate because we get to do a dry run with them the week before, and so we know what you're about to expect. So we really hope you enjoy today's session. And we're going to start off with Chris and Jason. They are from the City of Hillsboro, and they are the IAP2 USA Organization of the Year. So Chris is a Senior Project Manager for the City of Hillsboro, and the Hillsboro 2035 Community Plan and the Hillsboro 2020 plan before it. Those have been his main responsibilities. Chris has also served as Project Manager for development of the City of Hillsboro's first organization-wide strategic plan, including creation of the city's mission and core values. So welcome, Chris. And then we have Jason. Jason Robertson is president of J. Robertson & Company, based in Olympia, Washington, and Portland, Oregon. He has a master's in community and regional planning, is a Peace Corps Fellow at the University of Oregon, and his company implements a wide range of community planning and development projects incorporating data-driven solutions, dynamic public involvement programs, and sound implementation strategies. His clients have been recognized by, among others, the League of Oregon Cities, the U.S. Forest Services, the Washington State Governor's Smart Communities Program, and, of course, IAP2 USA. So Chris and Jason, we welcome you to today's webinar. Drew, I'm going to get you to give Chris the screen, please, if you would. And just a reminder, I am realizing as we're introducing everyone, we forgot to welcome our participants from Australia and New Zealand as well. So we truly have a worldwide group of participants on the line today, all looking forward to understanding a little bit about why these organizations were selected as the best of the best, and also for research. So Chris, how you doing?
Great, thank you very much.
Good, over to you now.
Okay, well, thanks, Amelia. It's our pleasure and honor to be here today to present. We were very honored to receive the 2016 Organization of the Year Award, and we're excited today to share some of our best practices on why. And so we have a lot to cover, so I think I'm just going to go ahead and jump right in. Jason and I will both be presenting. Jason will be doing some color commentary as needed, but we'll go back and forth just a little bit. So today's presentation will focus on our community visioning efforts over the years, and we'll emphasize how public participation has really become ingrained in how we operate as a city. We'll also look to provide tools and lessons learned, hopefully for other communities and organizations to use. But first, a little bit about Hillsboro, Oregon. So Hillsboro sits on the western edge of the Portland metropolitan area, about 20 miles from downtown Portland and about an hour from the Oregon coast. Our population's right around 98,000, and making Hillsboro the 5th largest city in Oregon now. Hillsboro is a major employment center. We are home to Intel's largest North American operations and many other high-tech companies. And so as such, we're often referred to as the economic engine of the region and of the state as well. Looking a little bit at our population growth, so as you can see from this slide, Hillsboro continues to experience dramatic population growth. Starting in about 1990, you can see growth just really take off here. When we started our community visioning efforts, Hillsboro was a little over 60,000 people, and our population increased by almost 40% just since then, just since 2000, and there was a lot of growth before that. So looking ahead, you know, this slide actually includes a pretty conservative projection for 2035. We've seen projections as high as 140,000 by 2035, and then around 160,000 at full build-out. This slide doesn't account for our daily workforce numbers, and as an employment center, that adds tens of thousands of people to our daytime population numbers as well. So looking a little bit at our demographics, Hillsboro is very much a diversifying city. At 25%, our percentage of Latinos is above the state average, and it's growing. Our foreign-born population is significantly above the state average as well. Our largest share of immigration comes from India, and Korea is second, China is third, and that's largely due to our tech sector that we have here. Our median age is younger than the state average at 31.7 years. So all of this is to say, you know, given this rapid growth and changing demographics that we have, the ongoing challenge really for the city has been, you know, how do we manage this growth in a way that enhances our quality of life and benefits our community? How do we welcome new residents and engage them, especially with residents from diverse ethnic backgrounds? And so for us, a big part of the answer comes from public participation. For us, it's been largely through our community visioning program and asking community members to define how they want their city to grow and evolve. So in Hillsboro, giving community members a voice is really a long-standing part of our organizational culture. Starting in the late 90s and with the adoption of our 2020 vision plan in 2000, Hillsboro has really directly involved residents in shaping the future of the city. Amongst all the growth and the change, you know, visioning is the key way for us to get the community involved in a broader way beyond just giving input on a land use plan or a street transportation project, for example. We've really gone bigger. Our 2020 vision plan was groundbreaking for its time. It won the IAP2 Project of the Year award back in 2002. So it's really great to be coming back all these years later as Organization of the Year to talk a little bit more about how we've ingrained P2 through the visioning process. 2020 plan grew to include 180 different projects over the course of the plan, and we were still able to get it done 5 years early. So over the 15 years of vision implementation, as I mentioned, P2 really has now become a part of the community fabric here. I think Jason is going to speak a little bit to this slide. One of the ways that the vision and P2 has become a part of the community fabric is community ownership of the plan. So Jason, you want to speak to that?
Yeah, thanks, Chris. So just for a little bit of context, at the time that Hillsboro embarked on its first vision plan, as Chris mentioned, there was dramatic population growth, and there were a lot of visible signs of it. So you have to remember Hillsboro, like a lot of North American communities, started as a rural ag community, and with all of the new economic development came more people, but also light rail. So all of a sudden, Hillsboro was connected to Portland on the main line, and people could see the change, and so there was a lot of angst about what's going to become of our community, and there's a lot we like about it that we don't want to lose, but we know it's going to change. And so one of the remarkable things about the City of Hillsboro, and I will say that this is pretty unique about Hillsboro, is the leadership, elected and management alike, were willing to let the community, I like to call it, open the hood of the engine and tinker around in there. And a lot of times government wants to sort of control information and control growth, and Hillsboro really wanted to know what people wanted. And so, as Chris alluded to, when you do a comprehensive plan, there's only so many things that people can talk about, and in ways they don't know how to talk about it. They don't want to come to a 2-hour meeting to describe their feelings about setbacks. But what they want to do is talk about things like what kind of schools are we going to have, or how are we going to get around. And the vision really allowed them to say everything they wanted to say, and then the city converted that input into actions that people could recognize. The other thing that Hillsboro did early on was adopted the living document strategy. You can have a 20-year plan, but really, if you don't set near-term goals over 5 years, then things get stagnant and you fall into the plan on the shelf syndrome.
Okay, thanks, Jason. So here are a few highlights from the 2020 plan. A new civic center and community plaza that was built in 2005, and the community plaza was really key because community members did not until then have a central place to gather. That was one of the things that they called out very clearly, and so we were able to produce that. Community gardens have been very popular in Hillsboro, and they're continuing to grow. The community also called for expanded libraries and library services, so there you see a build out of the second floor of our main library. And then when we did the community update in 2005 of the 2020 plan, Hillsboro did not yet have a off-leash dog park, and community members really called out for that, and so our Parks and Recreation Department was able to make that happen. So all of these projects were rooted in public participation, and I think that's one of the main reasons Hillsboro is recognized as a model for P2, is that we've been able to take community ideas and translate them directly into projects like you see here. So even after all the success of the 2020 plan and over 15 years of implementation, we didn't stop there. Our city again said that we want to plan for the future by utilizing public participation. So this led to the development of our 2035 community plan, which was adopted last year. And Jason, I think you're going to speak a little bit to the development process.
Yeah, and we promised Amelia we wouldn't get too much into process project here, but in terms of how Hillsboro structured its next 20-year plan, we started with a pretty hard look at data, and again, that's a lot to ask of a government to honestly assess where it stands, where it's going, what kinds of trends are occurring, and it turned out to be an invaluable exercise for us because a couple of findings that stood out. One is the diversification. We'd spent years trying to cultivate participation in our Latino community at near 30%, but as Chris mentioned, the East Asian population was also growing, and so looking at the data, we realized we needed to really diversify our outreach efforts in new ways to engage those communities. And the other thing that Chris alluded to was that daytime population. So we had about 70% of Hillsboro residents leaving the community for employment, and 70% of the Hillsboro jobs being filled by folks outside of the city. And I always joke that nobody likes the traffic. And so it kind of set up a real major theme for us to address through the visioning engagement, which is what's it going to take for Hillsboro to be a community that people want to live and work in, and what kinds of features, what kinds of mobility are people looking for. And so we took those themes along with others forward into the engagement process and involved, as you'll see here soon, many of the partners that we anticipated we would need to get the actions done from day one in the engagement, in the planning and action development.
Okay, I'm going to talk a little bit about what you saw on the previous slide as the phase 2, or the public outreach. For public participation, we worked really hard to offer community members lots of ways to participate, and we were extremely proactive on a number of fronts. One was to go out to where the people were headed anyway, going out to dozens of community events and meetings for face-to-face interaction. In our opinion, there is really no substitute for that face-to-face human element type of engagement. Another was using a broad technology platform, in addition, including online surveys, social media, an online forum, even text messaging. Perhaps most importantly, we targeted some of the groups that were most effective. When you're doing a long-range plan, it's really about the youth in your community, and so we targeted youth participation in many ways, including lots of visits to local schools. And then we reached over 1,000 community members through connections with our employers and our business community through an online employer survey. And that was really significant because we saw from the responses that we were able to reach a very ethnically diverse community that works in our larger corporations here, our mid-sized businesses, all the way down through to our smaller local businesses. So those were some of the areas of emphasis in terms of our P2. We were really pleased with the result of that, of involving over 5,000 community members. In the original 2020 plan, we reached about 1,500, but we were a smaller city then. So as the city has grown, we've exponentially expanded our citizen involvement numbers as well, so we're very happy with that. Jason, I think you were going to talk about just a few of the areas of top feedback that we got.
And just a quick reminder, guys, you've got 5 minutes left.
Okay, so we'll hustle. Thanks, Amelia.
We only need 4. Just quickly, the types of feedback we got, one of the top areas was schools and education. And I mentioned earlier, in a comp plan, a city doesn't really address schools, but that's something that people wanted to talk about. Similarly, we heard a lot about transportation and in mobility areas that transcend the city's authority. And so it set the stage for us to be able to engage with other external partners to help get done the priorities our citizens shared with us. Go to the next slide, Chris.
Yeah.
And so you can see here the diverse range of partners. So we have healthcare institutions, educational institutions, a lot of the places where we went and sought feedback, like the farmers market, became partners, a lot of social service entities. But what we realized, what the city has always committed to, and why it deserves to be Organization of the Year, is sharing the authority and responsibility for implementing community priorities with the benefits that come along with that.
Okay, and now I'm going to talk about integration of the community vision plan and really the integration of public participation into the city organization. And this shows you our long-term plan alignment. It shows how the vision and all the community values and priorities that come from P2 really sits at the top of the food chain for us, and it guides all of the city's planning efforts. We are now updating the city's comp plan, the land use plan, by using the same focus areas of the 2035 plan and many of the community priorities and values that got expressed in the vision. So that influences planning all the way down through our sub-area plans, infrastructure, to departmental budgets. This slide, every year city departments estimate their expenditures to implement the community plan, and these figures go into our budget document along with the narrative that ties the vision to just about everything we do as a city. The budget exhibit also shares key projects to be implemented. And again, the point here is that we make these projects very concrete and tangible for the public to see, and we ingrain the community's voice into the services that our departments deliver. It's also worth noting that the 2035 plan is also used to help the City Council set its goals and priorities every year, and they draw from that quite a bit. Ongoing attention to public participation, it is really a part of the culture here. Here are some of the other areas where we use the vision within the city. I provide training to staff and supervisors every year about the messaging from the public, the key components of the vision plan, and how we do it. We continue to do public outreach and collect input from the community. Even though the plan's already in place, we're constantly doing that. We often feature 2035 plan in newsletters, the website, and we've also done a lot of marketing and branding, even when it comes to giveaways and things like that to the community, with the emblem of the 2035 plan, so that it becomes very visible and recognizable throughout our community. Here's our last slide.
Yeah, and I won't read all these to you, but in short, to have a community vision sustained from the late 1990s to present, there's some key factors that make it possible. And first is leadership willing to invite others in to help shape priorities and implement them. It needs to be a living document, so you can have aspirational goals, but people need to see the results in the near term. Your metrics need to be reasonable. That means we don't try to put everything into empirical quantitative evidence. Sometimes it's qualitative. It's the stories you tell and the impact that things have had on people's lives. And it needs to be present and innovative. And so when we did the original vision, we didn't have social media. And so we adapted our engagement to be able to reach diverse audiences with the tools that exist today. And I'm sure we'll renew that approach again next time.
Well, thank you so very much to both Chris and Jason. That was fabulous. Thank you very much. We have one quick question from Larry, and Larry was just asking about control measures. What did you have in place, and how did they differentiate from the general survey to the online survey only to people asking questions on the street? So what were your control measures in place for that?
Well, Chris, I'll start. So what we do is we have a central database, and we have multiple tabs in the database that can tell you where input came from, how many times a certain theme was repeated. So we keep everything organized there, and then we keep sorting it into vision themes. And so if somebody said, I want large or smaller classroom ratios, and that was a theme that was heard 110 times, the group of people that are asked to do something about those inputs can see the intensity of comment.
Perfect.
And the only thing I'd add to that is on the data input side, we ran that through the city. So regardless of where the ideas came in from, what event or survey, the city was tracking all of that and inputting that into one place.
Terrific. Well, thanks very much to Chris and Jason, and to those of you that are on the line with us. We will come back after everyone's presented, so if you have more questions for both of those gentlemen, please hold on to them, and we'll come back to them a little bit later. But Drew, I'm going to get you to change to Shannon now, and I'm going to introduce Shannon Holmes. And Shannon is the Director of Patient Engagement and Community Programs in the British Columbia Ministry of Health. Shannon has delivered measurable results in a wide range of areas, including public engagement, marketing, facilitation, and communications. She is also an accredited business communicator through the International Association of Business Communicators. Shannon, it's a real pleasure to welcome you to the webinar today.
Thank you, Amelia, and thank you for everyone for joining us. And I just want to say how much I feel honored that the Ministry of Health was chosen as the IAP2 2016 Organization of the Year Award. We're over the moon and delighted about it, so thank you very much.
Thanks, Shannon.
So here's some of the things that I'm going to be covering today. So what is the Ministry of Health? What was the problem and how did we deal with it? What were our system-wide improvements? What is patients as partners? The IAP2 approach to our work, policies, training, collaboration, leadership and capacity building, results, and lessons learned. So we're here in British Columbia, so we're north of Chris and company. We're just in Canada here, and we're on the west coast. We're just above Seattle in Victoria. We have 4.6 million people in British Columbia. We have a very diverse ethnic population. In Canada, there's 35 million people, and in Victoria, which is the capital of British Columbia, we have 350,000 people. And I work for the Ministry of Health, and the Ministry of Health is the provincial government. In Canada, they have the federal government, which is a government that governs all the provinces, as an equivalent would be all the states. And then we have the provincial government, which is what I'm working for in the Ministry of Health, and then we have the city government, which is, you know, the mayor or whatever of the city of Victoria. And so the Ministry of Health has the overall responsibility for ensuring that quality, appropriate, cost-effective, and timely health services are available for all British Columbians. And again, in the USA, we would be equivalent to a state government-run organization. And in Canada, which is a bit different than the US, government figures largely in the workforce rather than big business. So we're mostly made up of provincial, city, and federal government organizations and small business. So the problem. Our healthcare system, which was designed mostly in the 1960s, was structured around the needs of hospitals and healthcare providers, with medical staff regarded as experts and patients as recipients of information and instruction. And I'm sure that all of you can probably relate to our mothers and fathers going to the doctor and following some sort of doctor's protocol and not questioning it and saying, well, that's what the doctor told me to do. Well, things are a little bit different today because of there's a lot of problems in healthcare, not only in Canada, but worldwide. Over the past decade, healthcare we've all experienced rising healthcare costs, an aging population, overburdened healthcare system, limited tax dollars, and patients wanting to play a more active role in healthcare redesign. So the approach that was standard is no longer sustainable. So what did we do here in British Columbia? Well, in 2007, the British Columbia Ministry of Health took strides to make system-wide improvements. With the multifaceted strategy contained in the Primary Healthcare Charter, the idea of partnering with patients was endorsed as a transformational approach that would empower patients, provide engagement training for patients and providers, so we would have a common language, a common approach, common tools, develop policy, and supports to implement a patients as partner systems approach. And there was two main principal aims, and that was to promote patient involvement in decision-making in the healthcare system, so actually allowing them to be consumers of healthcare, by providing patients with relevant tools. So again, that's the IAP2 competencies and capacity building, and to foster their active involvement in the continuous improvement of quality of care and services. So the Patients as Partners, it's a ministry program. It's a philosophy, and it brings together patients, families, caregivers, healthcare providers, not-for-profit organizations, non-government organizations, and universities to work together to include the patient's voice, choice, and representation in healthcare improvement. So what did we do? So we took an IAP2 approach. So recognizing the impact of healthcare improvements and the potential for reduced costs that could come from patient and public engagement, the Ministry of Health started supporting the IAP2 approach to patient and public engagement in 2010, starting from a place where there was no coordinated engagement activities, no avenue to harness the patient's voices, no shared leadership vision or supporting infrastructure. The Ministry of Health Patients as Partners program quickly moved to providing leadership, strategy, policy, collaborative efforts, and funding. Execution through coordination, training, engagement activities and mechanisms, partnerships, education, and the development of tools and resources set the foundation to achieve healthcare cultural transformation. And one of the important things that was a driver of this was in 2008, our Auditor General, they did a report proposing that government adopt principles and best practices for public participation. And that was based on IAP2. So their comment was getting public participation is essential. Getting it right is essential, and getting it wrong simply frustrates everybody. So what else did we do to improve our healthcare through engagement? Well, we have a whole bunch of policy documents, and government is always good at writing policy documents. So we demonstrate the value of patient engagement through our leadership's actions. For example, stakeholders were invited by our Deputy Minister to provide feedback on strategic policy papers, and one including the Patients as Partners. So here's some of them. We've got one called Setting Priorities. And what we wanted to do, it will require translating high-level patient-centered care concepts into actionable, attainable, and sustainable practices across all sectors of the healthcare system, including engaging medical, nursing, allied health and support staff, empowering staff, working closest with the patients and residents to individualize the experience of care, and using feedback from patients to evaluate and drive change. This approach will be built into governance evaluation as well as executive and staff performance reviews. So the idea was to not only educate the healthcare workers and the leaders, but the patients as well in a common approach. And here's some of our other strategic policy documents. We had the British Columbia Patient-Centered Care Framework, and in that document it says patients and families are encouraged and supported in participating in their care and informed decision-making at the level at which they feel comfortable of their own choice. The level of participation is determined through the spectrum of engagement outlined by the IAP2 system. So, you know, the range is inform, consult, involve, collaborate, and empower. And then we also had a primary care strategic policy framework as well. And then we had a whole bunch of series of policy papers by the Patients as Partners program. And the bottom one on the right, which says the Integrated Primary and Community Care Patient and Public Engagement Framework, that's the framework that endorses IAP2 principles, pardon me, and approaches. And we're just revising that now to update it, and that will be used, again, by patients, healthcare workers, and leaders in the healthcare sector. And so the Patients as Partners, we've sectioned the way that we approach our work into 3 levels. We have the individual care, so that's the conversation that the patient has with their healthcare provider. So they, you know, become more health literate and understanding what their problem is. And they can develop conversation, results-based conversations with their provider that's, you know, it's patient-centered, responsive, respectful, and collaborative in being a partner in their healthcare. And then at the community level, we bring patients, families, caregivers, and others and engaged in policy development or strategic planning. And then at the system redesign, we have patients, families, caregivers, and others engaged in the design, delivery, and evaluation. So the IAP2 core values for the practice of public participation provides a North Star for the Ministry of Health. And working with all these groups, we want people to make choices that represent what it is that they want based on the ability of how much level of influence that we can allow them to have based on existing policies and legislation. And so we have training. For the past 6 years, the Patients as Partners program has supported training through Delaney and Associates. They're based in Vancouver, and they've provided training for health authority, ministry, non-government, and stakeholder workers, and they've trained close to 800 healthcare workers in less than 10 years in IAP2 principles. We also collaborate. So in 2010, healthcare stakeholders, including patient partners, developed the Patients' Voices Network. So this was kind of like a stakeholder group of patients to be like a group that we can draw from to engage in different activities. So the concept came from the Vancouver Coastal Health, and what they do is they prepare patients for engagements by providing information about IAP2 informed best practices for patient engagements. They have webinar learning sessions, they have in-person training, they have networking possibilities, and by building relationships with healthcare providers that will encourage and enable patient engagement. So patients can participate in an online network to receive updates and complete surveys to inform healthcare improvement, or they can be trained a little bit more thoroughly and they can participate in working groups, committees, focus groups, and other processes for including their voice in the healthcare improvements in British Columbia. And as a result, in less than 10 years, approximately 40,000 patients have been engaged in different activities and engagement sessions. And with our leadership, we have a deputy minister and a minister of health. They've been very supportive of IAP2, and they've endorsed it, and that has been actually one of the things that has really driven it through the system. So capacity building. So it's done through the development and dissemination of educational materials and by the provision of IAP2 and other training educational sessions with numerous partner organizations. We continue to fund IAP2 training and support more than 100 organizations such as the Doctors of British Columbia, universities, health authorities to connect patients with their engagement efforts. So a lot of times I'll get calls from people all over the healthcare sector and say, I need some patients. I need someone to be involved in helping us redesign our residential care program. And we need some patients that are from the north. And we need some patients that are from an Indigenous population. And we need some seniors. And so I'll help connect those. And ultimately, we want them to go through our Patient Voices Network. But if they're unable to get them, then we have other ways of doing it. And then we have a 2-day meeting, which is called our dialogue. And we bring together patients, which is about 30% of an audience of 150 participants, our health authorities, our healthcare providers, non-government stakeholders, university folks, ministry representatives. And we talk about current successes in the patient care activities. We network, we share ideas, and we find out what are the priorities and what is it that patients are finding that they want to be involved in. We also have educational webinars that have been presented by a panel, and we try and include patients on those panels so that they can bring their perspective. And some of the topics that we've had webinars include partnerships for improvement, e-health, public involvement in health research, turning disagreements into opportunities, and developing speaking skills. And there's a bunch of links at the end of this presentation that you can go and see these different pieces of material. And finally, in less than 10 years, we've had 800 healthcare workers trained in IAP2 and more than 40,000 patients. But there's some stories in behind those numbers that is really important. So, for example, in Island Health, we had patients involved with developing tools for the surgical patient education website on topics such as how to improve healthcare before surgery and how to prepare to meet your surgeon. And that creates a better experience for patients. And then with Patient and family partners participated in the Interior Health Eating Disorder Regional Planning Day to foster engagement and collaboration and to gather information to be considered in the development of the Interior Health Eating Disorder Strategy. In Fort St. John, that's in northern BC, we had patient volunteers that were invited to streamline transitions from the hospital into community care. And as a result, they took 24 boring intake forms, which were consolidated into one to reduce processing time and repetition for patients. And in the Providence healthcare area, which is based down in Vancouver, we had a hiring committee for a respiratory therapist for St. Paul's and Mount St. Joseph's. And we had 2 patient volunteers work with general practitioners and radiologists to develop project-based solutions for improving communications and imaging results. And the outcomes were successful in that 77% of the physicians involved experienced improvement in the time it takes to get imaging results back, and all the booking clerks saw improvements in the completeness of the referrals, including steps that reduce booking delays. And as an aside, I used to work for the Ministry of Health as a patient advocate, and I used to deal with 8,000 to 10,000 patients per year, and I used to help them navigate the healthcare system. So I really, truly understand how important it is to have the patient's voice in shaping the healthcare system. And lessons learned, keep good relationships with all stakeholders, particularly the patients. The Ministry of Health had a misstep last year, and the patients were quite upset. And what the ministry did was they rectified the situation and stabilized the relationship with the patients, and now the patients are back, working with us in a positive way. Also, the other thing is to keep your leaders involved, informed and engaged about what it is that you're doing through patient engagement and your results. Coming from the marketing and communications area, I'm all about internal and external marketing. I see the benefit of it in having worked in other areas in government and in the private sector, and I saw the Patients as Partners program as just a nugget of gold when I arrived here and realized that nobody really knew too much about it, and that we needed to really raise the profile both internally and externally because there's such great work going on. And the thing about healthcare that's really interesting is that it doesn't affect just a portion of the population. It affects everybody. Everybody interacts with the healthcare system. And finally, measure, measure, measure. I come from, like a background of business, and I'm just instituting measures right across the Patients as Partners program and working with our contracted partners to develop measures that can show the impact and the importance of engagement. And then I've added a bunch of links here at the end, and you're more than welcome to take a look at them. And there's a really interesting one which shows some of the work that we've done with our Indigenous population, working with elders in the healthcare system, our policy papers, and our contracted partners as well. And so that's about it for me. Is there any questions?
Well, thanks, Shannon. There aren't any questions at the moment. There is one, but if it's all right with you, Shannon, we're going to come back because I'm just paying attention to the time, and I want to make sure that we have an opportunity to hear from Tina and Andrew. So we will come back to more questions once Tina and Andrew are finished, and we'll bring in questions from everyone. But I do want to remind everyone, just as we switch the presentation to Andrew, that all of this information will be available to you. Drew will be sending it out, so you don't have to squint your eyes to try and get those links. We'll make sure that you get the PowerPoint presentations along with the recorded message. So Drew, I believe you've handed it off to Andrew now, have you? So here we go. Here comes Andrew's. There we go. Excellent, Andrew. So I'm just going to introduce Andrew and Tina. Tina is an Associate Professor of Public Administration and International Affairs and a Faculty Research Associate at the Program for the Advancement of Research on Conflict and Collaboration. Her research focuses on citizen participation, collaborative governance, conflict resolution, and challenges in public administration. Andrew is the program director of the Jefferson Center. Andrew is responsible for the development and design of the center's deliberative programs, communications, and grant development. So with that, Andrew, over to you and Tina.
All right, thank you so much. And I just want to echo the rest of the presenters in saying that it is a tremendous honor for us to be recognized with this cohort of core values winners. So it really is exciting to be a part of this. Moving quickly, because I know we're running towards the end of the afternoon, talk about our research project, which is Clearing the Air, which is an ongoing research effort to do two things. One, engage patients to develop roles for patients to lead in the process of diagnosis and to improve diagnostic quality, but then also to assess the value of public deliberation in thinking about developing healthcare policy. This is a collaboration that we've initiated between my organization, the Jefferson Center, which focuses on public deliberation across a range of issues. Dr. Tina Nabachi, who as an associate professor has done a ton of research on the impact and quality of deliberation, and then two other organizations, the Society to Improve Diagnosis in Medicine, who is a clinician-led advocacy group trying to raise awareness and develop research to address the issue of diagnostic error, and then federal Agency for Healthcare Research and Quality, who has funded this initiative. So, kind of the foundation of this project is thinking, as Shannon alluded to earlier, that in order to improve our healthcare system, the greatest potential for improving the quality of health outcomes and making healthcare more affordable and efficient is to engage patients in their healthcare. And we're seeing a lot of institutions around the world, and particularly here in the United States, pursuing approaches that engage patients in their healthcare and helping direct the course of their care. But what we haven't seen to the same extent is involving patients in the process of developing policies that shape the healthcare system and the policies that shape institutions and how patients interact with the system. And so what we wanted to test is, are patients capable of playing that role in terms of leading the course of their own healthcare, but then also helping advise institutions on their policies in terms of how patients participate in diagnosis, treatment, and other issues of healthcare. And so we wanted to focus on diagnostic error in particular because at the start of this project it was an issue that was not very visible. Most people don't necessarily understand that up to 10% of instances in the United States in diagnostic, or 10% of all diagnoses are either wrong, delayed, or improperly communicated to the patient, which in a number of situations can lead to adverse public health outcomes. So we wanted to see, here's this kind of under-the-radar issue. Is there a way that patients can engage on this issue and bring some greater awareness to it, but then also bring some solutions? And as we've begun this project, the National Academy of Medicine here in the United States has just released a report on the issue of diagnostic error, focused on really system-led interventions to addressing the issue. And so it's a nice complement to the recommendations and to the work that we've been doing with patients to see, one, that a lot of the institutional efforts focus on the systems and how they can improve system-led interventions, and then also for us to say, well, here's the opportunity for patients to be involved as well. And so in just a minute, Tina will get into the nature of our research and how we structured this program, but we wanted to start from the foundation that this is a significant issue and that patients are negatively impacted by the issue of diagnosis in a way that they don't fully comprehend it. And so we wanted to change the dynamic a little bit and say, and put patients in the driver's seat of thinking, how do we address this issue? What is the role that patients can play in being their own advocates and improving the quality of the relationship between patients and providers to improve diagnosis and the process of diagnosis? And so, Tina, I'll turn it over to you.
Sure. Before I begin, can everybody hear me? I wasn't able to join the mic back.
Yes.
Hi, Tina. Yes, we can hear you.
Great. Fantastic. So when Jefferson Center, Maxwell, and the Society to Improve Diagnosis in Medicine partnered, we really wanted to create a randomized, controlled, experimental design for this research, because that's kind of the gold standard of research for at least many research fields. And it's also one that would help us really unpack the effects of deliberation. So we went through an intensive recruitment process and ended up creating stratified matched pairs of people that we then randomly selected and randomly assigned into 2 intervention groups, one that was based on just education, receiving information about diagnostic error, and another group that engaged in deliberation and came up with these patient recommendations. So we had 2 matched panels of 20. Both of the groups came together on the same time and day. They heard educational presentations from experts about diagnosis, the diagnostic process, diagnostic error, what it was, what its implications were. After that session, the group that just received the educational information completed a post-survey and left the room, and the other group stayed on and deliberated for an additional 6 days over the course of 2 weekends to develop patient recommendations. And before and after, there was a pre- and post-survey for both of these groups. Andrew, could you switch to the next slide? Yeah, great. So we had the education group, we had a small deliberation group, the citizens jury group that developed recommendations, and then what we wanted to know was, would another group of average citizens understand these recommendations? The people sitting on this webinar, we could all get together and talk about the design of water and sewerage systems and come up with recommendations, but then average people in our communities who didn't have the opportunity to participate in those deliberations might not understand what we were talking about. So we convened a third group of 93 diverse participants, and we asked them to assess the feasibility and the potential impact and the usability of the recommendations from their perspective as healthcare consumers. Again, for all of these groups, we did before and after surveys so that we could assess the changes or the impacts of those interventions on activation, trust in doctors, perceptions about diagnostic error, and so forth. We also had a control group that was surveyed so we could provide some baseline data. As we move forward from here, we actually just this past weekend wanted to take those recommendations and ask healthcare professionals to assess them. So would healthcare professionals perceive these recommendations as being usable, as being feasible, as likely to have impact on the diagnostic process and the diagnostic error? And as we move forward, we'll do that one last session with healthcare professionals. And ultimately, those recommendations, once the research is done, will be picked up by the Society to Improve Diagnosis in Medicine and will be translated into toolkits and postcards and other materials that healthcare consumers, patients, providers can use in a variety of healthcare settings. So just as kind of the quick recap of the process, we wanted to test whether deliberation had stronger impacts on individuals than education or doing nothing, and whether one of the claims we make in participation is that the recommendations that come out are better. So we wanted to see how other people would assess the quality of the recommendations.
And as Tina noted, the method of deliberation that we pursued was the citizens jury. We actually gave a more extensive webinar just on citizens juries last year at that link at the bottom. So if you want to learn more about the citizens jury process, I would encourage you to watch that webinar. And so, as Tina said, we had our deliberative group meet for 6 days and come up with recommendations for patients, for roles that patients would play in the process of diagnosis to ultimately improve the quality of diagnosis. And their recommendations focused on kind of 5 key strategies: presenting symptoms clearly and completely, asserting yourself in the relationship, coordinating your care, ensure accurate records and tests, and then manage your care. And then under each of those strategies, there were specific concrete action steps in order to guide systems, but then also patients themselves towards effectively implementing those recommendations in healthcare settings, and you can see those results at our website, jefferson-center.org/patient-prescriptions. And I wanted to leave this up here for a minute. This was the kind of opening statement that the jury wrote for their report at the end of the event, and we presented this to a group of professionals this weekend who are heavily involved in diagnosis and diagnostic care, and were just anecdotally really impressed with the quality of the recommendations and the quality of the learning that the jurors represented in their report. All right, Tina, you want to take back over with the evaluation?
Sure. So with the kind of individual level impacts, we were looking at patient activation, which is basically a larger, well-accepted measure in the health field to talk about how empowered patients feel to be responsible for their health care. We measured some health literacy questions, and then we also wanted to assess the quality of the recommendations in terms of their potential impact, ease of use, and how likely people felt they would be to use them. So again, patient activation, there are 4 levels of that. You could go back to that slide and look at it at another time. But basically what we found was that both education and deliberation, the small deliberative group, increased in a statistically significant way people's levels of patient activation. We also found that we had 3 health literacy questions. Unfortunately, they didn't hang together in an index, but we also found again that there were statistically significant differences in people's health literacy after participating in deliberation. Those and some other research areas show that deliberation did have a strong impact on those individual level changes. Again, that's something we're not surprised about from research. We know that. But something we haven't really studied in the participation literature is how well do people perceive the qualities that come out. We make a lot of claims about how strong the recommendations or the decisions that come out of participatory processes are, but we seldom evaluate those. And so what this is data from our 3rd group of healthcare consumers, and basically for each of those 5 recommendations, almost 100% of people understood the recommendations. The majority of people thought that those recommendations would improve diagnostic quality. People were a little bit, there were some different uses there, different perceptions about how easy it would be to use in their own healthcare, but again, the majority of participants thought they would be easy to use, and more people thought that they would be likely to use those in their own healthcare. So those to us signal that this deliberative group was able to produce recommendations that other people would find to be actionable and reasonable. So as we're moving forward now to assess some perceptions among professionals, and we have a really nerdy hope of looking at the impact of these recommendations in clinical settings.
I think with that we can skip through our scenario results, which was putting people in the position to imagine a scenario that they would face in the healthcare setting and then see what recommendations they would use to navigate that situation. But in the interest of time, we'll just kind of conclude, and as we've said, we are looking to test these recommendations in clinical settings, and really we want to see if recommendations that patients develop through deliberation have the capacity and the potential to positively impact the delivery of healthcare in ways that compare to recommendations that are developed by professionals, and to see whether or not patients then do have a key role to play in developing healthcare policy. So with that, I will open up to questions for the rest of the group, given our short time. And if you have any direct questions for us after, please feel free to give us an email or call or look on our website. Thanks so much.
Excellent. Well, thank you so very much to Andrew and Tina for that. And one of the things I forgot to mention is that this particular project also won International Research of the Year awards. So they were recognized as the best of the best within the world as well from a research perspective. So what I'd like to do right now is open it up to questions from our participants that are on the line, and you can ask questions about any particular project or organization that you've heard today. And I'm going to start with one for Shannon, and it's from Carol. Carol said, we have been wrestling with what training they need and also about the amount of payments or reimbursement we give them. what do you do? And I think this is related to patients, but potentially internally as well. So any thoughts on that, Shannon?
So what we do with patients for training is we have the Patients' Voices Network set up, and we offer training to them based on IAP2 principles and practices. We don't pay patients to participate in engagements, but we do pay for their expenses if they have to travel, because of course British Columbia is a pretty big province. If they have to travel or if they have to eat lunch out, then we'll pay for that. But we don't pay money for patients' participation. Does that answer the questions?
Well, I think so, but maybe I'll open it up to Andrew and Tina as well, because the citizen jury has a slightly different take on this. So any thoughts on that question?
Well, I think for the citizen jury perspective, we always pay participants to attend. We want to ensure that we have a diverse group of participants that are helping to shape the recommendations and shape the discussion. So as far as that, we a significant portion of our budget is devoted to the costs of getting participants in the room and making sure that there aren't extensive barriers to diverse participation.
Excellent. Thank you. So again from Carol, she works in healthcare in New Zealand, and they also involve patients on committees, etc. But what they've been wrestling with is what training they need. Oh, and we already asked that one. Sorry, I just missed the top part. I forgot to introduce Carol as one of our participants from New Zealand, so my apologies for that. So the next question is from Anne, and it's for Tina and Andrew. What are some of the team's initial thoughts on how healthcare organizations can take these learnings to improve healthcare understanding and diagnostics at scale or in the field?
That's a great question. And so, as Andrew was saying during the introduction to this, most of the research on diagnosis and the diagnostic process and diagnostic error, all of those recommendations are driven from a provider perspective or a health systems perspective. And what we're seeing here is that there have been very few recommendations or very few ideas coming that are driven from the patient perspective. And so I think for us what this says is that there are ways that patients can engage. The patients are not only able to do it, but they're also willing to do it. They want to do it. And so I think thinking about broader sections of patient engagement, broader approaches to that, making participants comfortable is really important. The next stage of research that we're hoping to do is to examine the recommendations in a clinical setting, not only to see what their impact is on diagnostic quality, but also to see how it changes providers' attitudes and reactions towards patients. So are they going to be excited and engaged by patients who ask questions and follow up and who are empowered in their healthcare, or will they find that threatening? And I think once we do that, we'll be able to speak a little more broadly to the potential things that hospitals, clinical settings could do.
Thanks, Tina. So are there any other questions from anybody else out there? There was a lot of great information shared today by all of our presenters. And before we wrap up, I'd like to give all of our presenters the opportunities to make any comments, any recommendations, encourage people to apply for the Core Value Awards next year, because I think, as many of them might tell you, you actually have to start planning fairly early to think about what you might have done within the core values process. So, and just in case anyone is interested, we're likely to open up the next application process for Core Value Awards next March, both in Canada and the United States. But let's do a little bit of a wrap up while we wait for some more questions to come in. So let's start with Chris. Chris, any last thoughts as we wrap up today's webinar?
Just that I really enjoyed the process of applying for the Core Values Awards, because it led to a lot of self-evaluation and analysis, and you know, we talked about a program that has been in place here at the city for almost 20 years. It provided me the opportunity to kind of go back and to look at what are our best practices, what do we do well in terms of the institutionalization of public participation, and, you know, laying it out for the application, you do that very methodically. So I just felt the exercise was really helpful for me as project manager. And it was a pleasure to also attend the conference and to meet so many other practitioners in P2. It's good to know there are like-minded individuals out there that do this good work. So thank you.
Excellent. Thanks, Chris. And it was great to have you there. Jason, any last thoughts from you?
Nope. I echo what Chris said, and just thank you guys for being out there and giving people something to shoot for.
Excellent. Thanks, Jason. Shannon.
Amelia, I just want to thank you and Drew for being such great supports going through this process. I pulled together the application quite late, and I'm just so delighted to be able to participate in this whole process. The way that everything was set up was well organized. It was really well done. I really enjoyed the conference. It was, and with any conference, you know, if you don't notice anything that's awry, you know how much hard work has gone into it. So again, I want to thank you for all the hard work. The speakers were wonderful. The presentations were great. And it's great to be part of the community. So I can't thank you enough. We're very delighted to be honored in this way. And again, thank you.
Oh, you're more than welcome. I'm glad you've enjoyed everything. So we're going to go to you next, Andrew, and then we're going to go to follow up with Tina. Andrew.
Thanks. And so, yeah, I just wanted to say that for those of you who are interested in applying for the Core Values Award, I would definitely encourage you to do it. But I would also, for those of you who are a little, you know, less confident in your projects, I would definitely look at the core values criteria and think, how does your project hit on each of these points? Because it is a really clear, useful way of evaluating whether or not your project is on the right track in terms of being innovative and really authentically engaging citizens to shape institutions, governments, etc., and to really take that lead. And I think that's a nice. The core values is a nice checklist for seeing, you know, whether or not you're on the right track in terms of approaching how powerful and meaningful your projects could be.
Thanks, Andrew. Tina.
So I would just thank all of the panelists who talked today for doing their great work, and for all of the people who are listening for also doing great work. I know that around the world, across the country, around the world, people are doing really exciting things in public participation, and I'm excited to always hear about those innovations and the research and the impacts that they have. And I would say a special thanks to IAP2 for making it possible for that community of innovators to come together. And awards or no awards, I think the work we're all doing here is really important. So thank you for playing that role and for being the convener of all of these groups and organizations and individuals who are trying to make a difference.
Well, thanks very much, Tina. And I'm going to come back to our presenters in just a minute, but I want to remind everybody about next month. We're offering you a chance to contribute to next month's webinar. Civic Engagement Specialist Susanna Haas-Lyons will be here to talk about social media and P2, and she wants to draw on your own experiences. What examples are there of digital engagement that's worked well? And perhaps not so well. So please take a few minutes and fill out Susanna's survey form. You'll find the link in the upcoming webinar section or on the front pages of IAP2 Canada and IAP2 USA. So we're excited about our upcoming December webinar. But I would be remiss if I didn't say congratulations again to our wonderful presenters today, to Chris and Jason for winning the IAP2 USA Organization of the Year, to Shannon and the BC Ministry of Health for the Organization of the Year in Canada, and for the Jefferson Center and Maxwell School Research Project of the Year US and internationally. Congratulations to all of you. I hope that this has inspired those of you that have participated in today's session to think about applying for our Core Value Awards next year. So bye-bye, everyone. We look forward to welcoming you back in December, and thanks again for your participation. Bye-bye now.